Okay, so I'm here today with Brittany Kearney, and Brittany is with PACE of Southern Piedmont. And this is a program that works with adults in the 55 and older community. Before we get into what exactly PACE is, why don't you give me an idea of what your background is and what led you to the front door of PACE?
Thanks, Drew. Yeah, I'm so glad to be here with you today. My background, I've been with PACE for 2.5 years now, and my background has been in long-term care services. So this fit very nicely with what my experience is. I worked in nursing homes in the admissions department for about 8 or 9 years before gladly finding PACE. And throughout, I've always been involved with gerontology, and I have my master's in business administration. I have my master's in gerontology, and that's what really led me to PACE, thinking about the quality of life for our seniors in our community and how can we really expand that. And so my role in this organization is just to tell everyone about PACE and what it can do for seniors.
So what is PACE? How long has it been around? Things like that.
Yeah, PACE is an acronym that stands for Program of All-Inclusive Care for the Elderly. And that's a mouthful. And when I say that, people, it does not explain what we are here as an organization. We've been here for 8 years. We serve Mecklenburg, Cabarrus, Stanley, and Union County. We are a health plan and provider for services for older adults. There's eligibility behind it. So who we serve is those that are 55 years of age or older, who need additional support in their home to remain independent, and that want to stay aging in place at home versus going to live in, say, some other form of a community like assisted living or nursing home.
Okay. How long has PACE been in the community?
Our organization has been here for 8 years, but PACE as a whole is a nationwide program. It's not available in all areas, but the areas that do have PACE programs across various states, a total of over 50 years.
Okay. All right. I'll make sure that I put a link to both the PACE of the Southern Piedmont and also to the national organization so that people
absolutely.
can search to see if anything's available in their community.
They have a search opportunity and it goes by zip code. So on the National PACE Association website, you can just type in your zip code. And if there is a program available, it gives you all of the contact information for who to reach out to. And if there's not, they also provide you with a resource of who you can call to see what is available in your area. Our organization, PACE of the Southern Piedmont, is nonprofit. We do have 2 sponsors, which is Contegra Services or Contegra Health, and Lutheran Services Carolinas.
How many locations do you have? In the Southern Piedmont is a pretty big footprint. Where are your offices?
Yeah, right now we're still fairly new. We've been here for 8 years, but the joy of this program is that we're not necessarily a bricks and mortar program. We provide services in the home. We provide transportation services. So if an older adult needs to go see a specialist, we're bringing them to it. And our actual center, which has our adult health and wellness and the medical clinic, so all of our outpatient services, is located right here in Mecklenburg County on the plaza. So it's 6133 the plaza. But like I said, we're not necessarily focused on the bricks and mortar because we can provide services where our individuals are.
So individuals will come to your brick and mortar, your location that you just mentioned, to see their doctors on site there.
Yeah, we have our medical providers here so they can come see their doctor or their nurse. We have our therapy services. If they need to receive therapy using more equipment than can be done in the home, they can come do that here. And then our adult day health and wellness. So socialization, activities, different programs that go on during the day.
Okay. But what if I'm one of your clients? My doctor is not going to be at your location.
So all of our PACE participants see their doctor with PACE. They have a provider here that serves on their team. And the team is comprised of over 11 professionals. And that's the provider, an RN care coordinator, a social worker, a home care coordinator. We have transportation, CNAs, therapists, and a dietitian. And they're all focusing on the health and wellness needs of each individual in our program. So not everyone that's in our program has the same services given. It goes based upon individual need, and we work with each individual to develop what that looks like based on what they need.
It's probably me being a little bit slow, but if I had a doctor that I've been working with for years, if he's not or she is not coordinated with you, I would need to see your medical team. Is that correct?
Correct. Yes. So we become the primary care, and a lot of our participants have been with their primary care provider for years and years and have that established relationship. But there's many providers in the community that know that when you reach this level of care or require additional services and supports to stay home, having the care coordinated in one location with providers who know more than just your medical needs, but they also are fully aware of the social dynamics that may be going on in the home and the level of support that you have. It's at times makes sense for them to transition over just to PACE and have us as the primary care.
Well, I've also, on that note, I've also talked to friends, and it's come up in conversation that our medical team is getting older. And so they might be retiring, leaving us looking for replacement anyway. So that's not necessarily a bad thing.
And our providers specialize in serving older adults, and it is a limited number of participants to providers. So they have more access, more oversight of their medical care versus sometimes in the community when you have a primary care provider who's seeing over 1,000 individuals.
Mm-hmm.
It becomes, you don't get as much time with them, and things may feel a little bit rushed. And so we've heard nothing but positive things when people have been hesitant to give up primary care and, switch over to PACE, but then the outcomes, they're very pleased.
It's more of a team approach, more coordinated approach with, medications and prescriptions and things of that nature based on, I've seen problems before when people are injured and they go to one doctor to deal with an injury, and there's no communication about what's happening with the drugs and the medications and the interaction of those medications, which are not always a good thing. So I can see the advantage of that. And did you say also that transportation back and forth to get to
transportation to us and to other medical appointments if there are any in the community. When you think about your healthcare needs, absolutely anything and everything would be covered by the PACE program. It's wonderful that we could be so flexible with our model of care. For instance, the medications are covered and will be delivered to the participants. Any supplies or equipment that they need, if it's a wheelchair, a walker, a hospital bed, if they need to use any type of incontinence products, you're no longer having to go to the store to purchase those. Our home care coordinator will help. And one of the things I don't think that I mentioned is we do provide in-home care as well. And it could be home health, so skilled services, if they need that additional support from a nurse or from the therapy team, that can be done in the home. And even up to if an individual gets sick and needs to go to the hospital. Our participants don't receive medical bills for that. We're helping coordinate that care through the hospital, through the discharge planning and what services they may need afterwards as well.
So there's no cost to the patients.
So once they're in the program, based upon whether they're Medicare, Medicaid, or private pay, it could be a combination of the three. There may be a set amount, but after that set amount is met, there's no deductibles or copays for our program. And so it offers a huge peace of mind that they know month in, month out, regardless of how their care needs change, that they're not going to be spending more money out of pocket for the things that they need. So when they receive their medications, they're not paying a copay, or when they receive any additional services, nothing's coming out of pocket.
Okay.
For
So,
individuals, though, the program comes at zero cost, especially for those who are dual eligible or have Medicaid in the community. It's zero cost for them.
so my approach to looking at all these things that are retirement related is how it impacts the family. Like I want to make sure, like all my friends, we want to make sure we're taking care of mom and dad as they get older. And we don't want to, and our parents don't want to be an inconvenience to their adult children. How do you interact? I mean, is it, who comes to you? Is it the family that comes to you? How do you interact with the family? So how do they get to your door?
Yeah, well, it's a mix of everything. So there's no referral that's needed to enroll into the PACE program. Anyone can reach out and get information and start the process. We have family members that call on behalf of their loved ones.
Okay.
Live in a time now, we see it a lot. There's the sandwich generation.
Right.
The caregivers are raising their family, taking care of the older adult, and trying to balance all this in the services and the coordination. So a lot of times we do hear from the families that are trying to do that. But participants, individuals reach out themselves. Maybe they've seen our PACE van or they've heard it from their doctor. We also get referrals from providers in the community, from Department of Social Services or from home health organizations send us referrals.
So on the economic scale, are you seeing people from every point on the economic scale, or is it concentrated in certain areas?
No, it's this program. So think of it as kind of like how do I explain it? It's like a concierge medical services, right? Where everything's coordinated for you in one place. You have one team, one phone number you're calling for all of your health needs. And so when we think of the cost of long-term care, even for, on the economic scale of those that would be private pay, the affordability of our program versus other long-term care opportunities is drastic. If you want to stay living at home in the home that you love with the support and care that you need, versus going maybe into like a long-term care facility, it's drastically different.
It seems like I can't have any of these conversations without asking how COVID has impacted the day-to-day business. What did it look like pre-COVID, and how are you managing it now when people wanted to be isolated? And you're probably working with the demographic, the older people who are more vulnerable to
Absolutely
the risks of COVID. So how did that impact the way PACE operates?
Well, at the start of the pandemic, but before the pandemic, a lot of our services were really heavily focused on bringing individuals into our center, into the day center, whether it was for adult day, for the therapy, for all their needs, they would have to come here to have those needs met. But now with the pandemic, we've really been able to shift and pivot to provide more services in the home. We were able to offer telehealth solutions for individuals. So instead of getting the transportation, being picked up by our transportation and brought in, we can do the telehealth visit. Or instead of being picked up and brought into our therapy gym, our therapists are coming out to the home. So it's allowed us more flexibility to really cater the care plan for participants to truly meet what their needs are. And then we've expanded even more into doing virtual program and activities. So individuals can join from home if they're not coming into our adult day and participate in activities along with everyone else.
Okay. And has that been well received?
Absolutely. And our adult day is opened right now with limited capacity. So where before the pandemic, we might have over 100 people coming into the adult day. Right now, so we're looking in the middle of November, we have about 45 that are coming in on average every day.
Mm-hmm.
So it's been really great.
So you've got the one location that you mentioned earlier, big footprint here in Southern Piedmont. You cover a couple of counties. Any thoughts of expanding into some of the other communities?
when we think about proximity and access, we want to be near the services, especially if you need to use the outpatient services. And so there are opportunities to move, build the center in some of our other areas. But there's, right now, we have the access individuals from Cabarrus County. We have individuals that are in our program from Union County as well. And then right here in Mecklenburg County, there's such a great need as well. So down the road, I'm sure that we will be expanding throughout our service area.
Brittany, that was great. Really good primer on what PACE brings to the table here in our community. And
Absolutely.
and
Thank you
I
so
look
much, Drew.
yeah, I look forward to trying to get the word out and communicate with as many people as I can about your services. I think it sounds fantastic. So
Wonderful.
okay, thanks again.
Thanks, Drew.